Thank you very much, Mr. Chairman. Good day, everybody. And it's a pleasure for me to be here and speak about management and biosecurity scoring in pig farms, the work that we have done in our EU Prohealth project and also in previous studies. Here you see an outline of our presentation. First, a short introduction on animal health and the things that are important for that. Then we will discuss the scoring tool that we have developed and also used in our research project. The results of the scoring, previous studies and in the project, and we will end with some take-home messages. You will all agree that animal health is important, but actually we do not measure directly animal health. What we usually do is we measure disease or presence of pathogens or absence of pathogens, or sometimes the level of management, but we do not directly measure health. If we consider disease and we want to quantify or investigate that, it's important to determine at which level we are working. Right? Do we work at the individual level, which in pigs is actually not that important. In pets and horses it's important. But in farm animals, usually we look at health at a group level, farm level, national level. And also we should make a distinction between, do we speak about disease or do we speak about infection? Because many animals are infected with pathogens, but not necessarily diseased. Importance of animal health: better production, carcass quality, less zoonosis and antimicrobial use, which is of course important at this stage. Every disease is affecting animal welfare, so if we have better health, we also have better welfare. And then lastly, the soft characteristics of animal health. It contributes to more motivation of the farmer, work satisfaction, and also a better image of the sector at national level, but also at international level. And of course, also these soft parameters are important. Here you see a simple table in which I put down the performance of the sows, the fattening pigs, and also some health characteristics. Several decades ago, in 2010, and a prediction for 2025. And in green are the reproductive performance parameters of the sows. And you can see that during this period we have made tremendous progress, improvement in our productivity of our sows. A same but less pronounced trend can be seen for the production of the fattening pigs. However, if we look at some health characteristics, like percentage of pigs with lung lesions, pneumonia or pleurisy, you see that these values have more or less remained the same. So we have not made such a major progress, such a major improvement compared to the success story in the reproduction of our sows and also the performance of our fattening pigs. And you also see the results reflected in the use of antimicrobials. Here in this figure you see the results of treatment incidents in 50 pig farms, sow farms, in the year 2010, so it is already 7 years ago. But what you see on this graph is that in general we see a high antimicrobial use. The value of 200 means that if you have 200 pig days, or 1,000 pig days, 200 are treated. Or else, if a pig is living for 200 days, approximately 1 out of 5 days it is treated with antimicrobials, which is high. Of course, the levels have decreased significantly in the last 7 years. But anyway, it is shown that still on the health aspect of our pig production, there is work to do. And you also see the large variation between the farms. And some farms actually produce with almost no antimicrobials, whereas others need almost double the incidence of the average. Why do we use a lot of antimicrobials? We are in some way victim of our own success. We have more live-born piglets, weak-born piglets sometimes also. Colostrum production usually has remained the same, but we have more piglets, so we have less colostrum per pig. We wean slightly earlier than in the past, meaning that we have a lower weaning weight. In some farms, the management, the nutrition and the housing is insufficient. Antimicrobial use, also it may in some farms be a type of habit, kind of insurance. Also we have other factors that may explain in more or in some way this high antimicrobial use. I spoke about colostrum and the fact that in many pig farms the piglets do not consume sufficient colostrum. And here you see the results of 10 farms in which we measured colostrum production by the sow and also colostrum intake by the piglets. And studies have shown that actually a piglet should ingest at least 170 gram colostrum per kilogram birth weight. And you see here, based on this data, that almost 1/3 of the piglets did not comply with this minimum number of colostrum intake. If they do not ingest colostrum, they have problems or they are more susceptible to disease and also to a lower performance and a higher risk for mortality. Health, we are not there. The situation has not significantly improved in the last years, or last decades actually. If you look here at the figures of prevalence of pneumonia in 2 slaughterhouses in Belgium, these numbers are based on more than 100,000 slaughter pigs. And you see also, confirming what I said, that more or less the prevalence remained the same. Maybe the severity or the extension of the lesions has decreased, has improved over the years, but the percentage of pigs with lesions has more or less remained the same. We did a study some years ago in 3 different European countries, including Spain, and here it's confirming that pleurisy and also pneumonia is still highly prevalent. And if you compare it with the numbers of studies decades ago, we see more or less similar values. So we still have a high prevalence of disease, respiratory disease, but also other diseases. Respiratory disease, definitely economically important. Here you see the results that porcine respiratory disease complex may have on the technical parameters, growth, feed conversion ratio. And here are the results actually for Mycoplasma hyperpneumonia infections only, not the severe mixed infections. And you see already significant losses in performance. So high prevalence of disease, but also high impact of disease on performance. Here in this table you see the results of an American study conducted at Iowa State University by Daryl Holtkamp, and they assessed the financial impact, not the impact on technical performance, but the financial impact of 3 or 4 major pathogens for the US pig industry. And you can see that the impact of PRRS, Mycoplasma and swine influenza, is really tremendous. They made distinction between the losses in affected farms, and also they estimated the losses for the average farm in the US. affected and non-affected. And you can see here that, for instance, in the case of PRRS, it was more than €7 per pig produced. So a huge economic loss by disease. High prevalence, high impact on technical performance, high financial losses. So what do we do? Well, we know that most diseases or disease complexes, as we usually call them, in pigs or in farm animals in general, are multifactorial. We will not solve the problem by just looking at one aspect. So there are many different risk factors that interact with each other, that can enhance each other, so leading to more severe disease. And that makes things, of course, not easy. We have many of such disease complexes. I just mentioned here or listed some examples of syndromes or disease complexes that we face in the pig industry. Some very important, others maybe not that important. But anyway, if we talk about complexes or syndromes, it means that we really do not fully understand how the disease develops, how the pathogens interact with the pathogens, with the host, with the animal, and how we can solve the problem. So instead of focusing on the pathogens, we could also think of focusing on the environment, on the biosecurity, the housing, and the management. And that's what we want to do by scoring biosecurity and management in pig farms. You all know that we make distinction between external biosecurity and internal biosecurity. External meaning that we try to keep out pathogens as much as possible. Internal biosecurity measures that try to limit the spread of pathogens within a herd. Biosecurity is definitely important. It has always been important, but if the farms become larger and more intensive, and when you have more transport and mixing and all these things, definitely biosecurity becomes very important, and it's therefore necessary to get insight into how good or bad biosecurity is in our production system, so that we can manage the risk of disease outbreaks or pathogen spread. So that as a general introduction, showing the importance of animal health or diseases, and also the difficulties that we face in tackling these animal diseases in our pig farms. Now a few words on the scoring system. So we can, let us say, quantify the biosecurity and the management in a pig farm, but how can we do that? This was a specific aim of the Prohealth project, the European project that will be explained in a later talk. So that scoring was part of work package 1. And with that scoring tool, we want to highlight the strengths and also the weaknesses in the biosecurity in pig farms. The project had continued working on a scoring tool that was developed in the previous research, but we applied the scoring tool in many different farms and many different member states in Europe, and for pigs, but we also developed a scoring tool for poultry. So for the scoring tool is composed of two aspects, the external biosecurity and the internal biosecurity. For the external biosecurity, we had 6 categories, and for each category we had different questions related to that. So we had a category related to purchase of animals, or we had a category related to rodent control, or other areas in which pathogens may enter the farm. So for each subcategory, we had several questions, and the answers to each question that was weighted so that we end up with a score for external biosecurity. And actually the same or very similar for internal biosecurity, but in this case we focused on areas that are critical to prevent spread of pathogens within the farm. Not to prevent intake of pathogens, but to prevent spread of pathogens in the farm. Not every aspect has the same weight. For instance, purchase of animals has a high risk. It's very important in terms of external biosecurity. It's almost the most important factor for every infectious disease, to get pathogens on the farm. So we put a higher weight on that aspect compared to, for instance, the density of farms or pigs in the region, which is also important for some pathogens, but if you have to weigh it compared to purchasing animals, it's less important. For internal biosecurity, for instance, taking measures to prevent the spread of pathogens between different compartments, to have a strict separation of the age groups was considered more important than management of sick or rent animals, which is also important, but if you have to balance it, we gave more weight to the first aspect. So if you apply that, so it's a questionnaire with different questions, and if this is completed, you get a result as a farmer for the internal biosecurity, the external biosecurity, and overall. And interesting, the farmer can see for the different subcategories where his farm or her farm received a high score or a low score. Also, such graphs are generated so that you can in 1 second see whether the farm scores on average or in which areas it performs better or not. So in green is the average of the farms that are in the system, and the red one is then the score of a particular farm. And here another example, and you, for instance, on the right side, you see a farm that had a very low biosecurity score. So the green area is the average, and you see that for all categories that farm scored lower. And in some areas, for instance, disinfection and cleaning, the score was 0. So meaning that this farmer did not pay attention at all into any of these aspects. So that for the tool as such, in the scoring tool, let us look at some results of studies that we performed in previous studies. Here you see the results of external biosecurity in 50 farms. And you can see that some aspects here, for instance, purchase of animals and semen, that the farms perform pretty well. But for other factors like the quality of the water or the hygiene of the water and the feed and the equipment, that was poor. Also bird control and rodent control was a critical aspect, and environment and region. That study was conducted in Flanders, which is a very pig dense area, so that may have contributed to the low score of environment and region. Here you see the score of the internal biosecurity, which in general is lower than the external biosecurity. So farmers pay more attention to get pathogens out than to prevent spread of pathogens within the farm. But you see that some areas, they perform very well, but on others also improvement is possible. So in general, management and biosecurity, what does it mean? To my opinion, its personal opinion, is that is do the basic thing properly, but also consistently. It's an everyday challenge, not only during the week, but also during the weekend, the holidays, and so on. Because a chain is not stronger than its weakest link. I think this is definitely applicable also for biosecurity. Such a scoring, it provides a general idea and is good for sensibilizing farmers and benchmarking. And most of the farmers are interested. How am I doing? Does my farm compare with other farms? And have I improved since the last year or last 2 years? So usually farmers are interested in that. Point, of course, is that it's based on a questionnaire that you have to fill in, and of course, one can fill in the correct answer, but this does not necessarily mean that this is also done in practice. So farmers, but definitely also advisors, including veterinarians, usually they know the correct answer, but they do not necessarily practice it in the farm. What does it mean, having a good biosecurity? Well, we also did some studies in which we tried to relate the score of biosecurity with performance and with antimicrobial use. Here in this table you see the relationship with production parameters. And you can see that actually there were significant and also positive associations between biosecurity and performance. Meaning farms with higher biosecurity have better performance. However, you also see that the R-squared values are low, meaning that the explained variation in performance by biosecurity is low, meaning that many other factors, apart from biosecurity, have an influence on performance. But nevertheless, significant association with growth, but no significant association with mortality, at least not in that study population. We also assessed the associations with antimicrobial use and the treatment incidence, and here we found a negative association. Farms with higher biosecurity used less antimicrobials, but also here very low R-squared values, meaning that many other factors apart from biosecurity had an influence on antimicrobial use. Here you see the results of antibiotic use in Belgium, and we have a plan developed some years ago that in a period of 10 years we should lower our antibiotic use by 50%. And also have a significant reduction of medicated feed and 75% reduction of the critical antimicrobials. And so far, we are pretty successful and we are on the predicted estimates of that reduction. It's a bottom-up approach, not a top-down. In that sense, it may take longer, but on the other hand, it's an approach in which the entire sector is involved, and we think that in the long term, that may have a more sustainable effect than something that is obliged top-down. But anyway, you can discuss on that. In a top-down approach, you may go faster. But anyway, we are glad, it's not always easy, but we are glad that we can reduce the antibiotic use without actually jeopardizing the production and the performance of the farms. And here you see the results of another European study that was conducted and in which we supervised or helped farms and herd veterinarians to reduce antimicrobial use in the different production stages, in the sows, the piglets, and the fattening pigs. And you can see that here for the piglets, that we could achieve 25% reduction, for the fattening pigs, 75% reduction, overall approximately 40%, and in the sows also a small reduction, but antimicrobial use in sows is not that high in these farms. But anyway, it was shown that it is possible to achieve even better results with less use of antibiotics. Biosecurity scoring, you have seen the values. Definitely there is room for improvement, but I think we should also emphasize that in many farms, biosecurity and hygiene and things like that is done very well. I think it's also important that we give that message to the pig farms. You see here some good examples of for instance, where you have to change clothes, here a shower, here that there is bird control, here for disinfecting equipment, washing hands, devices to clean the pens, and so on. So many good examples. But of course, in some farms, things can improve. As you can see here, in some farms, the hygiene definitely is a problem. Here you see a food bath, which should be considered to disinfect the boots, but I think in this case it may contribute to the spread of pathogens rather than disinfect. But anyway, so there's quite some variation between farms. These were results from previous studies. We have also used that tool in the Prohealth project, and then on a large scale in different countries, and we have focused on sow farms and also on fattening pig farms. And here you see the results of the sow farms. In total, more than 200 were included. And you see here some descriptive data of the number of farms in each country, also the years of experience of the farmer, the number of workers that were present on each farm, and also the number of sows. It's quite interesting to see that in some countries one person could manage almost 250 sows, whereas in other countries it was 140 sows. Here the results of the biosecurity scoring in these different countries and the sow farms. External biosecurity scored 76%, internal biosecurity always lower, 56%. And you see that Denmark, for instance, had the highest score for external biosecurity, and actually also for internal biosecurity, although the difference there was not so high. But it means that maybe farms pay more attention to, let us say, prevent intake of pathogens from outside, rather than taking measures within the farm to prevent transmission between the different age groups. It may also has to do with the fact that this is maybe more difficult, has more to do with management, whereas this has also to do with management, but also with the housing and more general things. This is something that is mostly imposed on others, whereas this is something that has to do with the own way of working. But you see quite some variation between countries, and also quite some variation within a country. We also scored fattening pig farms, because the scoring tool can be used for different type of farms, sow farms, farrow to finish farms, fattening pig farms. Here in total we included more than 170 farms in 4 countries, and you'll see the results here, and some descriptive data. You see here on average 1.6 workers per farm, who had approximately 750 pigs per farmer or per worker. You see also the size of the farms here in the different countries. The scoring, external biosecurity slightly lower than for the sow farms, but the internal biosecurity was slightly better. And again here, the same conclusion, variation between countries, but definitely also within a country. So for the external biosecurity, which were the good areas, categories, that was purchase of animals and semen. Almost all farms purchased semen, and the health status of the AI centers was in general higher than of the farm. Approximately 2/3 of the farms purchased breeding gilts, and they also in general did it well, paid attention to the source of the health status of the farm. They usually purchased from one farm, practiced a quarantine period that was also sufficiently long. So purchasing of animals and semen is a risk factor, definitely, but the farms paid sufficient attention to that and also took preventive measures. Critical issues related to external biosecurity was related to feed, water and equipment supply. Only 16% of the farms had a specific route for materials to enter in the farm, and only 1 out of 4 of the farms took measures to clean or disinfect materials or equipment before entering the farm. For the internal biosecurity, in general, disease management was also done properly in many farms. Most of the farms had a pre-listed vaccination scheme and protocols for treatment and all these things. In many farms, most of the farms, there was also a regular evaluation of the health status. Because this is the first step, you need to know what is present in your farm before you can do some prevention or control. Critical was in the farrowing period, in which cross-fostering, of course, is necessary to let us say, balance the litters over the different sows in order to have sufficient survival of the piglets. But from a biosecurity point of view, cross-fostering and mixing of piglets or transferring of piglets frequently between different sows is a risk factor. And in 30% of the sows, of the farms, it was possible to move the piglet more than once. And also on 2/3 of the farms, cross-fostering was not only done in the neonatal period, but also later on after 4 days. So in conclusion, most farms are infected with major pathogens. Fortunately, only a few of them develop clinical disease. If disease develops, usually it's multifactorial. It's not due to one risk factor, but different factors may play a role. Management and biosecurity is definitely critical to health, but also to performance and welfare. And objective scoring is actually very interesting, and I would say needed for benchmarking and also to measure improvements over time within a farm. In general, the farmers were very cooperative with the project and were interested in the score of their farm and to compare it with other farms. Of course, during the herd visits, we also gave some advice and recommendations, so it was not just filling in the questionnaire, but it was also some additional guidance of the farmers, and they like it, of course. There is a large variation between the countries in the scores, but also within farms, over time, between farms within the country, sorry. Here you see the scores again, usually around 70% or more than 70% for external biosecurity, between 50 and 60 for internal biosecurity. Best scoring categories were the attention that was paid to purchase of animals and semen, and disease management, and critical factors were the entrance of equipment in the farm, water quality and these things, and the farrowing period and the transfer of piglets from one sow to another frequently and also for a long period of time. The project is not yet done. We are currently in the phase of trying to, let us say, find a relationship between the different risk factors on the one hand and all the performance parameters of the sow farms and the fattening pig farms on the other hand. So I hope the next time to present also these results to you. So, and with that, I would like to thank you for your attention. I'm happy to take any questions.